Good morning. So today we're going to go ahead and cover nail theory. We're actually going to go ahead and cover the nail structure, nail growth, nail diseases and disorders and conditions. So we have quite a bit to cover today. I know that this is review for some of you. It's a good review because this is what you do. This is what you should know. So we're going to go ahead and jump right into it. And I hope you enjoy and learn lots, or it's a good refresher for you. So at the end of the lesson, you should be able to describe the structure, growth, diseases, disorders, and conditions of the nails. So you should be able to talk about the nail anatomy in itself, the way the nail grows, and then identify some of the diseases, disorders, and conditions of the nail. And it's really important that you guys understand that when you are actually looking at an abnormal nail, something that is departured from its normal state of health, that you actually are able to identify whether it's a disease, a disorder, or a condition, because there is distinguishable differences in all three. So we will be discussing those as well. So at the end of today's lesson, hopefully that's what you're going to be able to identify. So as far as nail theory in itself, nail, the technical term for nail is onyx, which is an appendage of the skin. If you're not familiar with appendage and what that means, an appendage of the skin means that it's an attachment of or a forward growth of. So if we look at appendages of the skin, hair is an appendage of the skin. It's a forward growth of. It's also attached to the skin, and as well as the nail. So what is important about that is basically that if we need to have an understanding that basically what nourishes the skin is what's nourishing our nails as well. That's one of the reasons why there's hair, skin, and nail vitamins, because they all have a similar form of nourishment. Now, onychology is the study of the skin. The study of the nail. It's the study of the structure and growth of the nails. So this is one of the reasons why that terminology can get a little confusing, because we see that term ony, O-N-Y, used in so many of the different nail diseases and disorders that and conditions that we look at. Let's talk about the structure or the anatomy of the nail. Okay, so we know of the outer part, which is the plate part, and then we're going to go into some of the internal structures. So if we talk about the nail structure in itself, it's all the exterior aspects of it. So as we look at it and we look at the free edge extends beyond the end of the finger. So basically this is the portion, this is when we have long nails because it's actually extending above and beyond the end of the fingertip, okay? Then we have the nail body, which is also known as the plate in itself. So it's the visible area from nail root to the free edge. Now, a healthy nail is going to have some flexibility to it. The nails aren't going to be extremely brittle. They're going to be strong. They're not going to look all dull and dry. They're not going to be chipping. And so that's the goal as a manicurist, is to try to do everything you possibly can to keep your client's nails as healthy as possible. Sure, we can disguise them by putting other elements on them, decorative elements and other things to make them look, at their best. But sometimes you have clients who can't sustain any enhancements on the nails. And so it's important that we try to also give the nail, not only to try to give it the appearance of health, but also try to make them as healthy as we possibly can. Then there's the nail wall. Now the nail wall is not necessarily anything that has to do with the nail in itself. It's basically the fold of skin. It's the fold of skin that overlaps, that comes up into the nail on either side of the nail groove. Now the nail groove, not visible here, but I'm sure we'll be talking about it. Those are the little tracks or slits that the nail is growing along the way. And then there's the lanula, which they say really has no function at all. They say it's basically a reflection of light, of connective tissue. And in some nails it's visible and some it isn't, but it's a half moon shape at the base of the nail. As far as the structures that are continuing to surround the nail, well, we have the eponychium. Eponychium is the cuticle that overlaps the lanula. We have the cuticle, which is the loose and pliable skin overlapping the skin around the nail. Now, the thing about the cuticle is that that's the substance that we actually cut. It's usually dry and overlapping, and the reason why it's pliable is because it's already dead skin. The attached stuff is the stuff that if we go through and we try to cut it, it actually does have some blood supply. So the eponychium, it overlaps the lanula. The cuticle is loose and pliable, overlapping skin around the nail. And then we have the nail matrix, which is the active tissue that generates the cells. If the matrix, as long as the matrix is in healthy condition, the nail will continue to grow. So the matrix in itself, right in through this area, this is a flap of skin that's coming up so that you could see that it's a part of the interior. And as long as it's in healthy condition, the nail will continue to grow as well. And then the nail root is an actual attachment. It's attached to the matrix at the base of the nail. They go hand in hand with the growth of the nail. And then you have the mantle. The mantle is, again, it's almost like it's skin related, right? It's that flap of skin right there. And this is a pocket-like structure that holds the root and the matrix. And if you look at your actual nail in itself, it actually it does feel a little looser and pliable, a little softer there. We have a lot of structures there that it's protecting. The nail bed area is I like to, the reason why we say that the body rests, think about, well, when you're on a bed, you're resting. So this is the part of the nail. This is that fleshy part right there, and the plate is resting on it. It's the area in which the nail body rests. And again, if the nails and everything is in healthy condition, you have good circulation, it's going to be pinkish in color. And because the plate is translucent, it shows pinkish underneath. Now, if the person has poor blood circulation or any blood circulation issues, it's very likely that it's going to have more of a bluish appearance. The nail grooves, those are the tracks or the slits on either side of the nail as it grows. So this is what's keeping the nail on track. The perionychium is the skin that touches, overlaps, and surrounds the nail. So the perionychium, that term peri means like outer, as in perimeter, and so it's on the outskirts, okay, and it overlaps and surrounds the nail. And then the hyponychium is right underneath the fingernail, and so it's the skin under the free edge. As a side view, if you're looking at a cross section of the finger, this is what it would appear like. Your free edge portion that extends, the body, which is the plate. The bed is more of an interior structure. It has the pinkish in color that actually does have blood supply. You have the nail root right in through here, and the matrix would be found right beneath it. They're all, they connect, they're attached, and this is of course bone right in through here, part of one of your phalanges. All right. As far as the nail growth, the matrix contains active tissues from which the nail growth originates. Cells created in the matrix are pushed outward from the nail root. Cells keratinize as they grow toward the nail and become fully hardened by the time they reach the eponychium. Growth of a new nail plate may take anywhere from about 4 to 6 months. So in order for a nail to fully replace itself, it's going to be about 4 to 6 months. They say the average growth of a nail is about 1/8 of an inch. Now, when it comes to that nail growth, keep in mind that those cells have to die. The new ones push those cells out. The nail keratinizes, it hardens, and it continues to grow out. But unless that nail or those cells die, then there's no nail growth that happens. This is part of the reason that if one of the reasons why when you trim the nails or you cut the nails do not bleed, because the nails are actually dead. They're dead matter. At an average, the nail grows 1/8 of an inch per month in adults. It's more rapidly in younger people because of cell reproduction, that it occurs at a faster rate. And they say our nails grow faster in the summer than they do in the winter. I have heard people say that it's due to the amount of water and how cells generate so much quicker. And of course, it is important that you guys understand that the nail growth is also affected by nutrition, health, or disease. And another little known fact is they say that everyone's favorite finger, the middle finger, grows faster and the fastest, and the slowest is the thumb. Injuries to the nail can result in shape distortions or nail discoloration. Just remember that as long as the matrix is in healthy condition, the nail will continue to grow. So even if there is a nail injury, it can still continue to grow, but the result can be a distortion in the shape or maybe a nail discoloration. Now, most nail injuries are minor and temporary, but permanent distortion can occur when a nail is lost due to trauma and the nail bed of the matrix is injured, or is lost through disease or infection. And you know what? There are many doctors out there that when they see that fungus has become chronic, that they will just go ahead and remove the nail. So sometimes, you know, it is a medical decision that due to some type of infection or disease, they go ahead and they remove it. Now, here's something that are really important for us to understand, because we throw these words out like they're nothing. Nail diseases, nail disorders, and nail conditions. There's a difference between the three, okay? Onychosis is any disease, disorder, or condition of the nail. So basically, it's any departure of health. Here's the thing that I want you guys to remember. The term it means departure of, okay? It means it's separated from. So usually when we see those terms so like disease, that means that it's away from or departed from ease. Disorder, it means it's departed from order. So that term onychosis is important for you guys to remember, that it's any disease, disorder, or condition of the nail. So it's any departure of, okay? Now, 4 factors to be considered, okay? Identification, etiology, diagnosis, and in-salon treatments. Identification would be to identify the disease, disorder, or condition and identify it as which one of these it is. Now, just because the nail looks ugly or it looks bad, it doesn't necessarily mean it's diseased. It might be just a disorder. It might be just a condition. And even if you can't necessarily treat it, you might still be able to work on it or around it. Etiology would be the cause of. So what is its cause? Is it disease related? Is it just a disorder? Is it a condition? So etiology would be to diagnose the cause of, right? And then the diagnosis is the identification by symptoms and prognosis, and then the outlook for recovery. So when you're doing a diagnosis, not only do you want to identify the symptoms, but you're also gonna, say, okay, long term, this is what this nail is gonna do. And now you need to be the one who looks out for the recovery of that nail. And then any in-salon treatments. Maybe it's frequent manicures that are gonna help your client. Maybe it's the frequent use of a certain nail product. Maybe it's, you recommend your client to stop getting acrylic nail services because it's drying out their nails. So what are the treatments that you are going to offer as a manicurist to be able to give your client the best results? Okay. Now, nail diseases, disorders, and conditions also require hand and nail examination. So you do a hand and nail examination, not like if you're digging for something, but you're going to be looking at the top of the hand, the bottom of the hand. You can look in between the fingernails or in between the fingers. Look at the nails without any polish or products on it. Okay, and this is so that you can discover problems associated with hands, nails, or growth of the nails. Begin with a hand and nail examination. Observe hands and nails to determine the type of services that should be performed and look for 6 signs of infection. Okay, we're going to go over those 6 signs in just a second. But keep in mind that a healthy nail is smooth, curved, without hollows or wavy ridges. It is flexible and translucent and pinkish in color. So those are the signs of a healthy nail. Now, the signs of disease, disorders, or conditions, well, some of the signs of infection are going to be pain, swelling, redness, local fever, throbbing, and pus. Those are red flags for you guys. So if the client is complaining of any pain, it's usually associated with any form of inflammation. Any swelling is going to cause pain. Redness means that it's irritated. Local fever, it's going to be hot to the touch or warm to the touch. Throbbing, if your client is feeling any form of throbbing, that means that there is some form of trauma there that is causing it to pulsate. And then, of course, pus. If you see any form of pus, then you know that it is infected. It's usually some type of cocci bacteria that is causing that infection. Okay. So during that hand and nail examination, hold the client's hand and turn front and back while observing. Observe the temperature of the skin texture or feel of it, any inflammation or redness, the color and condition of the nail bed, the condition and length of the free edge, tenderness or stiff joints, and then the shape and thickness of the nail plate. So those are things that you should be looking out for when you're doing a hand and nail examination. Now, when it comes to nail diseases, onychomycosis or tinea unguium or unguis is ringworm of the nail. Okay, here's what I want you to remember. Tinea means that it is ringworm in itself. Tinea unguium, and think of the term uña, like that's the UN part of it. Uña means nail, but tinea is ringworm. Unguium means of the nail. This term tinea, when we say tinea capitis, it's tinea or ringworm of the scalp. When we say tinea pedis, it's ringworm of the foot. When we say tinea unguium, it's ringworm of the nail. Okay. The cause is fungus, disease related. It can result from nail injury invaded by fungus. What the prognosis, that becomes thick, discolored, may fall off and must be diagnosed and treated by a physician. Don't go give them your grandma's remedy. You need to have it treated by a physician. And as far as treatment as manicurists, no service may be performed. Okay, and you know what they say is that 75%, you have a 75% chance of it reoccurring once you get it. Tinea manis, okay, like manos or manicuring, is ringworm of the hand. The cause is also fungus and disease related. The prognosis, it appears as rings containing tiny blisters. They can have dry flakes. They can be confused with eczema or contact dermatitis, and they must be diagnosed and treated by a physician. And as far as the treatment, no service may be performed. Refer to the client to a physician. Tinea pedis is athlete's foot or ringworm of the feet. Cause, fungus, disease related. Thrives in dark, moist places. Prognosis, itching and peeling of the skin on feet. Blisters form containing fluid leaving sore or itchy skin on on one or both feet. And then it must be diagnosed and treated by a physician. As far as treatment, no service may be performed and you need to refer the client to a physician. Paronychia or felon is inflammation of the skin around the nail. The cause is bacterial infection, and you can see that pus forming right in through here, and look at that, just throbbing and redness right in through that area. The prognosis is it can occur if there's hangnail, or if a hangnail gets infected. So like, let's say if you are using unsanitary tools and you cut your client when you cut a little too much and create a hangnail, then there's a good chance that you may actually cause that infection if you're using unsanitary tools. So if a hangnail gets infected, that may have it might have been okay and even healed on its own, but if it becomes infected, there's bacteria that can grow, and then before you know it, it turns into something like this. The prognosis: red, swollen, sore, warm to the touch. The person can lose their nail. It must be diagnosed and treated by a physician. The nail may grow out deformed, just depending on how much damage is done back here, remember, to that root and the matrix. And then no service may be performed. Refer the client to a physician. Onychoptosis refers to shedding or falling off of the nails. The cause is disease or injury related. If the disease is cured, the nail will regrow. It may occur on only 1 or 2 nails. The nail bed may be sensitive and should be protected while the nail regrows. As far as treatment, no service may be performed on affected nails. Refer the client to a physician. Onychia is an inflammation of the nail matrix. The cause is bacterial infection and disease related. As far as the prognosis, you'll see a pus formation, red, swollen, and tender. The nail may stop growing and the plate may detach. If the nail grows back, it will probably be deformed, and it must be diagnosed and treated by a physician. As far as treatment, no service may be performed on the affected nails. Refer the client to a physician. Now remember, all these are diseases. So as far as diseases, they can be contagious. They're going to have some form of bacterial infection. These cannot be treated by you. So they're all being referred to the physician for a reason. Onychotrophia is atrophy or wasting away of the nail. The cause is injury or systemic disease. So this is something that the person can have within themselves. Any systemic disease means that it's running through their system. As far as the prognosis, what the client will see, what you will see, is that the nail shrinks in size, may separate from the nail bed. If illness related, it may not improve if the matrix is damaged. If the nail may improve in about 3 to 6 months. Remember, they're slow to recover from some of these things. And as far as the treatment, no service may be performed on the affected nails, and refer the client to a physician. Onycholysis refers to loosening or separation of the nail. The cause is internal disorder, infection, or drug treatment, and it's of systemic and disease related. As far as the prognosis, is the loosening of the nail plate starting at the free edge and then progressing to the lanula. Now the nail doesn't come off, so it's just a loosening of the nail, and it must be diagnosed and treated by a physician. Do not touch it. No service may be performed on the affected nails, and refer the client to a physician. Now, nail disorders. Nail disorders sometimes look worse than what they are. Some may become infected, but for the most part, if it's a disorder, again, it's just out of order. So blue nails appear bluish in color. The cause is usually systemic, which means that it's already in the person's system or in their body make. And it's usually of the heart, systemic problems of the heart, or poor circulation or injury. The prognosis or the appearance is that it's going to be blue, in color, and a blue color in the skin under the nails. It can be solved if the cause is eliminated. So if the person starts having better blood circulation, if they get that under control, then most likely it will be eliminated. And of course, it is common in older people. And as far as the treatment, make the client aware of the problem and causes, suggest seeing a physician, manicure with caution using light pressure. Remember that anytime we do any form of massage, even the lightest form of massage can actually circulate the blood up to 7 times faster than what it normally goes, or what it normally is. And as far as working on your client, you want to go ahead and do a manicure as usual. You just want to use maybe lighter pressure when you're doing the massage. Okay, more light strokes. Eggshell nails. These are very thin, soft nails. The cause is usually hereditary or nervous condition. The prognosis is that the nails are thin, almost see-through and transparent. And as far as the treatment, regular application of the top coat is recommended, nail strengtheners or artificial nails, and good dietary practices. My only issue with the artificial nails is that sometimes eggshell nails have a growth in which the tip of the nail grows downward, and then there could be separation of the nail tip and the actual nail, causing moisture to go under there. And you guys know that any form of moisture, there's a good chance of mold and separation or lifting of that nail. So just be cautious about that. That may be your client, in the event that they decide to cover up the eggshell nails by using some form of artificial nail or acrylic, that those acrylics are probably going to have to be changed quite frequently, instead of the client being able to go through long periods of time and just getting fills. If you have any questions on that, feel free to comment, and I go back through and I check these, and I'll be happy to reply. As far as continuing with nail disorders, corrugations, these are horizontal wavy ridges across the nails. The cause is injury, systemic conditions, and uneven growth. As far as the prognosis, what you'll see visually is horizontal wavy ridges across the nail. If injury related, it may grow out. If systemic conditions may cause it permanent, they might cause the permanent ridges. So if it's something that has to do with the person's system, it might be something that's permanent, but it's a disorder. It doesn't necessarily mean that it's going to be anything, horrible to you or contagious to you. It looks worse than what it is. As far as treatment, lightly buff to level the nail surface, apply a base or top coat or ridge filler, and then avoid over buffing, because you don't want to thin out the areas that are already thinner, causing the wavy ridges. Colonicchia or spoon nails. These are nails with a concave shape. The cause is systemic or long-term illness or nerve disturbance. As far as the prognosis, it's usually unusual nail shapes and likely to disappear. And so they kind of look scooped in like a spoon. And then as far as treatment, file carefully, apply no pressure to the nail plate, and use polish to harden and protect the nails. And again, because of the distortion there of the shape, acrylic nails really aren't going to be a solution to this. Okay. Furrows. Furrows are indented vertical lines. So the other ones, the corrugations, ran horizontal. These run vertically, that run down the nail plate. The cause is usually injury to the nail matrix, cells to reproduce unevenly, nutrition, injury or illness related, pushing too hard with a nail pusher, exposed to harsh chemicals. Guys, when I see a list this long, you have to keep in mind that when they're trying to figure out what the cause of these nail conditions are or nail disorders are, and they give you a list this long, it's usually due to not really having an answer. As far as the prognosis, it may grow out or it may be permanent. And then the treatment, buff lightly, apply the base coat or ridge filler, and perform nail service as usual. Onychogryposis is also called claw nails. It represents an increased curvature of the nails. The cause is systemic. The prognosis, increased thickness and curving of a nail. It may occur with age or injury to the nail. And then physicians may remove if severely deformed or difficult to clean. And then as far as the treatment, look for signs of infection and clean well under the free edge of the nail. File with an emery board and keep the nails short. Podiatrists are the ones who should be able to trim these. So we're not really meant to work on these as far as the trimming part of it, but we can try to keep them clean, keep them filed. And then, of course, if there's any sign of infection present, you would want to refer them to a physician, okay? And then if they're severe, well, the physician may just make the decision to go ahead and remove them. Onychocryptosis. And then I see that term right here, cry. And the reason why I bring that up is I had someone say, anytime you see that term cry, or anytime you see cryptosis, right? They say crypt, like as in the crypt keeper. Cry, as in an ingrown nail may want to make you cry. The cause is environmental or poor nail trimming, and it can become infected because what happens is that these little corners right in through here, they'll dig into the flesh. So then at that point, the skin breaks. And remember, where does bacteria like to go? Dirty, dark, warm places, moist places, and it's perfect for it to grow if it's in shoes. The prognosis, if the nail becomes deeply embedded and or infected, refer the client to a physician. And as far as the treatment, thoroughly soften the skin, trim nails straight across. If infection is evident, do not perform the service and refer the client to a physician. Okay. We're going to go ahead and stop right here for today. We're going to be going into continuing with the nail disorders tomorrow, and we're going to go a little further on this chapter, but we're at about our 30-minute mark, and we will continue with this discussion throughout the rest of this week. So with that, guys, make sure you guys have a good day and stay safe out there.